survival for breast cancer patients, accelerated failure time models versus proportional Cox models. I introduce myself. I am a professor of biostatistics from Ilam University of Medical Science. I did many research in breast cancer, several meta-analyses, and I published them in the scientific journals. In these topics, I compare several statistical models to analysis of data because I think choosing the best method for analysis of data is very important because it can change the results. And I try to pay attention in this importance, and I worked on for data from Ilam Hospital, breast cancer. According to worldwide cancer reports, 6.8 million new cases of cancer and 2.5 million cancer-related deaths occurred in the world in 2018. Out of the breast cancer, around for 24.2 for all new cases and 15% of deaths. Generally, some predictor of the survival of breast cancer patients have been reported to be age, tumor size, lymph node involvement status, the stage of disease, grade of disease, metastasis status, recurrence, genetics factors, and type of treatment. The survival rate is the most important parameters for selecting cancer treatment and control strategy. The most of research was done on the cancer, and survival time, we compare survival time when we want to compare the efficacy or safety several treatments. We use survival times because it is the most important criteria. Different statistical methods are used to identify the prognostic factor affecting cancer patient survivals. In this regard, the Cox-Fish models is a semi-parametric and popular models because it doesn't require a baseline hazard function for estimating the hazard ratio and regression coefficients. Generating results comparable to those of parametric models. I watched the lecture in this Congress, and some of them use Cox, and some of them use Kaplan-Meier to compare groups. But in the majority of research was done in the cancer and survival time, they use Cox models because understanding Cox model is easier than others models. But the key assumption of Cox-Fish models is the proportionality of hazard for all predictive variables in the model over time. This key assumption is very, very important, but unfortunately, the most of research, they can pay attention to this importance. When this key assumption violate, we cannot trust the results. And in this works, I show this importance. When we change the method of analysis, sometimes p-value change, sometimes the result change. And we must check this assumption is met or not met for data. If the pH assumption doesn't met, the result of Cox models may be misleading. In this situation, we must use parametric models as an alternative to overcome this problem during survival analysis. Most parametric models are based on accelerated failure time or AFT models and don't require the Cox-Fish assumption. So when the pH assumption doesn't meet, we have to use another alternative, and one of our alternative is AFT model, accelerated failure time model. Based on AFT models, explanatory variable direct effect on survival rate are measured instead of hazard. Here we compute another index, and AFT models give us another parameters. And additionally, AFT model estimate predicted hazard function. They give us survival function, median survival times, and time ratio. Time ratio, it's like hazard ratio, as it is a one criteria or index to compare different treatment, different risk factors. Intervention of time ratio effect size is easier and more relevant for clinician. The objective is this research is determining the predictor of overall survival in women with BC breast cancer using the Cox-PH, Cox extended, and AFT models. I compare this model to each others. In this retrospective cohort study, we conduct on 318 women with breast cancer. Clinical, pathological, and survival data were obtained from several parties out. And we compare age at diagnosis, grade of disease, tumor size, and lymph node informant. We chose this patient from Ilam University of Medical Science, from hospital in Ilam. And we pay attention to these factors: estrogen receptor, ER, progesterone receptor, PR, and human epithelial growth factor, receptor, HER2. We choose this variable as a predictor for survival. In all of the study on the survival times, the main outcome was defined at time interval from diagnosis to this. I think the most of research, this is endpoint of is time from diagnosis to this the endpoint. We work in these variables. At first, I use descriptive and non-parametric analysis like Kaplan-Meier. I see in the many research presented in this Congress, they use Kaplan-Meier method to estimate the survival time function for all coverages. And we use a log-rank test. The log-rank is a non-parametric test. And we use to compare survival curve and determine risk factor associated with overall survival. But the Kaplan-Meier or a log-rank test cannot accommodate confounders. For univariate analysis, maybe they be good, but for multivariate analysis, we cannot use Kaplan-Meier or a log-rank. For multivariate analysis, we have to use Cox model or AFT models. And after that, I use Cox-PH proportional hazard and Cox extended models, and I compare several statistical methods to choose the best models. And also I use the hazard ratio. I think the most of researchers are familiar with this hazard ratio. The present categorical predictor variable, there is an increase in proportion of hazard change in a continuous predictor calculated from the Cox models. Relative risk or odds ratio, hazard ratio, or relative risk are similar, and they have same interpretation. After that, I use the AFT models, including exponential, variable, log normal, log logistic, and generalized gamma. I fitted these models to the data. To check the best models, I use QQ plots and another method like log minus log. Akaiki criteria, Cox single residual. I use several criteria to choose the best models. One of criteria to choose the best model is Akaiki. Akaiki is in minus 2 log likelihood plus 2 p plus k. Here p is the number of covariates and k is the number of coefficients in the models. If k equals 0, we can use exponential model. If k equal 1, we can use variables or log logistic or log normal models. And if k equal 2, we can use generalized gamma models. And the minimum estimate value of alpha is indicated. The fitted model is suitable for the data. And also, I use hazard function. The hazard function against coexisting residual, but this shows the best. We can use for this to choose the best models. And also, I use time ratio. Time ratio, the few studies they use time ratio. It is similar to hazard ratio. Is the proportion of time to event change as the existence of a categorical predictor variable or when there is a 1 unit increase in a continuous predictor as calculated from AFT models. I do statistical analysis with the spaces and theta because time ratio we cannot compute time ratio using spaces. Theta give us time ratio and for parametric models. We have to use theta or R or SAS. This research consideration in the ethics committee for Ilam University of Medical Science, and the protocol of this research approved in this committee. In this study, 318 women with breast cancer were followed up for 10 years after the diagnosis. The mean elevation at the diagnosis was 56. The range was from 24 till 89. At the end of follow-up, 192 patients were dead. The mean survival time was about 3 years, and the median survival time was 29 months. Here I compare some characteristics of patient age was not significant, LN status was significant, HER2 was significant in univariate analysis, and ER estrogen were significant, PR progesterone was significant, and grade of tumors and grade of cancer and tumor size, they were significant in univariate analysis. Here we show it is similar to Dennis graph. Here we see the line cross each other, and it show strongly we cannot use Cox models to compare HER2 negative and HER2 positive survival in these two groups. Here, because the pH assumption violated, and it strongly recommend us to use another method for analysis of data. And p-value here is not valid if you use a Cox regression. For goodness of it, DOF and graphical methods, so that the pH assumption was not met for all independent variables in the models. Here I show here the models. pH assumption for age and LN is met, but for HER2 not met. Here you see the HER2 not met, and here this p-value is not valid. This p-value is not valid, and we have to use another method for analysis of data. Here we have a time. I use another method, time-dependent coefficients. Some In the survival data, we have two types variables: fixed variables and time-dependent variables. Some variables, such as sex and race, don't change during follow-up. We say fixed variables. And some variables like blood pressure, age, they change during follow-ups. We say time varying variables because they change with times. And for analysis, these two kind of variables, we have to use another alternatives. Here I compute the hazard ratio in the multivariate Cox regression. But here we see in the multivariate ln positive against ln negative, the predictive factor significance. But HER2 in the multivariate regression is not significant. In the univariate, it was significant. And also, we see grade and tumor size. Tumor size is significant, but grade is not significant in multivariate. It shows the information over tumor size and grade, they combine together. And if we have tumor size, it gives information of a grade. And here we can see tumor size and ln are independent predictive factor. But grade is not independent predictive factor because in the multivariate analysis, its effect was not significant. Or also ER and HER2 in the univariate analysis, they were significant, but here they are not significant. And it shows we can, with less variables, we can predict survival times. And here I show QQ plot for oral survivals, and it shows to choose the best model we use in this graph. Here when we want to use accelerated pair time models, AFT models, in multivariate analysis, we use AKG criteria. I compare in GG exponential, viable, log normal, and generalized gamma, and log logistics. Are these models are AFT models? When pH assumption was not met, we can use these models. Here it shows log logistics is the best models, log normal and viable. The AKG is near together. In another model, it shows, because sometimes we use graphicals and statistical tests together to choose the best models. Here in the show, the viable model is better fit to data. When we choose the best model to fit of data, it can give us the best results. And the p-value or another test according to this test is better, and the result is, we can contrast the result. The result is valid. In the viable AFT models, the estimated accelerated failure time, TR, is 0.66, suggests a shorter survival time for women with LN involvements. When time ratio is less than 1, it says survival time is shorter and the patient dies sooner. And also time ratio for PR, estimated 1.91, indicating the positive PR could delay this. And the estimate TR for HER2, ER, G2, and G3, this is great. I compute them. I show time ratio and also other ratio. Time ratio is different from other ratio. When time ratio is less than 1, it's shown the hazard is increased. Here, time ratio is 63. It shows the patient die sooner. And this factor accelerated the dying time. But the other issue is one point. It showed the risk of death is high in this patient, LN positive versus LN negatives. In the most of research, they use hazard ratio because it is similar to odds ratio and relative risk. But time ratio, sometimes we use this. Index, especially when the p assumption was not met, it is better we use the time ratio. But here, hazard ratio compute from viable pH. It not compute from Cox models because hazard ratio from Cox models is not valid here because the proportionality was not met. And here we see a small hazard estimate. It shows after 80 months, the hazard of death increase. In here we see the hazard of death against time. We can see the constant rate of women's die during follow-up. But after 80 months, the risk of dying increased dramatically. Discussion and conclusion. This study was conducted to determine the impact of some prognostic factor on overall survival of women with breast cancer. We concluded that viable model was the best model to analyze the data and identify the prognostic factor associated with odds ratio in women suffering breast cancer. Some factors such as more advanced disease rate, a larger tumor size, LN involvement, lack of PR expression, HER2 positivity, and ER positivity were associated with oral survival in this patient. The Cox pH model is one of the most commonly used models for analysis of survival data, and its applicability has been approved in many studies. As you know, Cox was a scientist, and his research has the highest citation in the science. The AFT models present the sociable description of the survival data in the most sociables. Several research, they use the AFT models, and in the study was done in the Cuba, they use General's Gamma as the base model for breast cancer data. And also log logistic models, an appropriate model showing good fit into breast cancer data. And the study was reported by Amran and other studies. They use viable models. One of the limitations of this review was the low number of the studies, and sample included. The main focus on this in this study, potential prognostic factor on overall survival on breast cancer patient. I think the further studies can be done. I here showed the references. In conclusion, I can see for analysis of data, at first we should check pH assumption. If pH assumption was met, it is better we use Cox models. But when pH assumption violated, we cannot use p-value Cox models. We strongly recommend AFT models. In AFT models, we must choose the best model fitted to the data, or Cox pH models, or sometimes maybe we use the Cox piecewise models. In the study of Denise, I see the hazard in a time after a time, they constant, and here it is better we use piecewise models. Thank you for coming along. If you have any question, I have at your service.
Thank you very much, Dr. Kourosh.